I am pro-life, and
You're
I have met.
our choice.
You can call it that. That's fine. I have met many women that have had abortions. I have many friends that have had abortions that are also pro-life or pro-anti-choice, whatever you want to call it.
Pro-life.
And they have had horrible abortion experiences too, but instead of it making them bitter towards the restrictions, they actually agree with the restrictions. They agree that abortion should not be legal, and they wish that someone had been there for them to prayerfully help them through it and help them not to have the abortions. I have family members who've had abortions, so I've been very close to people on both sides, and I love them, you know, as much as I love the baby that was aborted. I have no condemnation of anybody. I know everybody has to make their own decisions, and sometimes you're put in hard places. I just met a woman who was raped when she was 15, and she said she was pregnant with twins. She lived in the projects. She wanted an abortion. She couldn't have one because she couldn't afford it. And she said those two children are the biggest blessing to her today, and she's so grateful that she couldn't afford it. And you think about, and as a believer, I definitely feel like God helps us. She didn't have the money to have an abortion, but God helped her provide for those children. So I think it's about knowing God and trusting Him to take care of your hard situations. I came from a family of 10. My parents were very poor. My father could not work. My mother had a high school education, but we had a lot of love. We didn't need material things. We had love, and that's pretty much my story. That wasn't what I thought I was going to be speaking about. I also work as a nurse, and I work at an ambulatory facility, and we do follow the guidelines that we're supposed to. One thing about this law, though, I do think it is really to help protect women who do have abortions, so they're not in unsafe facilities when they go to have abortions. It's trying to hold them up to the standards that people that work at regular facilities like I work at have to follow as far as the safety that protects the patients, that protects those women. Right now, I think they can have up to 30 without having to follow under these guidelines, and they're wanting to reduce it to 10. I would like them to reduce it to 1. If you have 1, you have to follow the safety guidelines that other facilities have to follow. And again, this protects the women as much as the child. It's just to put those guidelines in there to make the facilities that are going to do these one way or another safer for the women too who go in there. And I would hope that people on both sides could agree with that we need to make these facilities safer and follow safe guidelines and protocol.
Thank you, Ms. Paxson. Susan Decker-Bunsey?
I'm Susan Decker-Bunce. I'm the Executive Director of Save a Life Montgomery. We do business as First Choice Women's Medical Center. We see the repercussions that comes from the abortion clinics. We have many girls who have had issues with their abortions, and we also have a program called the Hope Group that takes care of the women who have had problems with their abortions, and we try to help them dealing with that. We see that many of them end up with drug addictions and alcohol addictions, and just trying to help them through that. We also just trying to put forward more of the adoption. Most of the women that choose abortion, they do it for not what I think is in the media, but they do it because of finances or just because it was not planned a long time. And what a horrible way to choose death for the baby. But I think that this will help to save lives in the long run.
Thank you. Terry Jen Server. Okay, I'm sorry, I cannot read the handwriting. Please, thank you. If you'd state your name for the court reporter.
My name is Terry Gensimer,
Gensemer. I am a pastor and priest in Birmingham, Alabama, and I work for my communion internationally as a pro-life representative. If it's all right with you, I actually wrote questions, and I know we're not supposed to put this in the form of questions, so I'm going to do my best to make statements based on my questions, and if they can be addressed, that would be really good. First of all, I want to thank the Alabama Department of Health for the work they have done in trying, within the law, do the best they can to keep our women in Alabama safe in these places that are doing abortion. My concern is dealing pretty much with the change that will be made concerning reducing the number of abortions down from 30 or less to 10 or less. I have some questions, and I'm like the lady who spoke before. If it was up to me, I wouldn't want any abortions done in the state of Alabama. But knowing that the law is the law, my concerns are this: that first of all, I'm not clear on what would be what purpose would a physician have, a normal physician, what purpose would he have for doing, or he or she have for doing 99 abortions a year? I can't imagine why someone that's not an abortionist would be doing that. The other thing is, or another thing is that I'm not sure who would be monitoring these doctors' offices that go that are doing that many abortions outside of the health department regulations. Seems like there's no one to monitor them except maybe the Board of Medical Examiners, and I don't know that they have people that could come in and do inspections, or who would be counting how many abortions are done. If someone says they're doing less than 10 abortions a month, who's counting? How do you know if they're not being reported? Another thing that bothers me is that theoretically there could be one building that would be somewhere where more than one doctor could be in the office, each one doing 9 abortions. I think that's right, 9 abortions a month, or 99 a year, and basically become an abortion clinic. Then also, I'm concerned that if these doctors' offices, as I guess they're called, and that's what they're trying to call them in Birmingham, if they are doing abortions, are they subject to the Pain Capable Act? Are they subject to HB 57, which was passed last year? Can they do late-term abortions? I'd like to know about some of that stuff. That concerns me. And also, I'm concerned that there are other. We know in Birmingham there's a clinic that's operating. We filed an amicus brief with the health department on the clinic in Birmingham that's doing less than 30 abortions, or they say they are. And I'm just not clear on whether or not there are other places in the state that are using that law to allow abortions to be done outside the regulations of the health department. I'm concerned that there are other places around the state that are doing the same thing, and I really would like to know if the health department knows anything about those, or if they exist. But that's really all I wanted to say. I want to thank you for having this hearing and for the work that you've all done to and do everything you can to keep our state safe. Thank you.
Thank you, Mr. Gensemer. I'm sorry. And we appreciate you being here, but as I explained before, this is the time for the public to give input. We are not to answer any questions. If we have any questions of you.
Yeah, and I'm sorry I wasn't clear about that before, and even the lady in the front said she thought we would be able to ask a question, but I meant to put these in. These are concerns that I think I have and other people across the state have. So.
Right, and I think you have raised them. So
yeah.
thank you for your for being here. Next is Matt Phillips.
Yeah, I don't think